Hello everyone, this is Eli from Inspire Fitness Academy, and today we're going to be discussing the benefits of exercise in the management of polycystic ovary syndrome. Let's start by discussing the learning objectives and the outline of this session. So at first, we're going to be defining polycystic ovary syndrome, or PCOS. We're going to be discussing its risks and causes. We're going to be discussing its symptoms alongside with its possible complications, the medical diagnostic tools alongside with the suggested treatments. And finally, we're going to be discussing the nutritional strategies, or what are the things to be taken into consideration when it comes to, or when we are referring to diet or whatever we eat, if we are managing PCOS. And finally, the benefits of exercise, or how can exercise help someone in the management of PCOS. And here we're going to be discussing what the studies say when it comes to several parameters that, or several causes that leads to PCOS, and how can exercise help us manage each and every one of these causes that will be discussed definitely in the upcoming slides. But first, let's start by defining the term, or defining the disease of, or the syndrome, which is referred to as PCOS, or polycystic ovary syndrome. So the name polycystic, it means that you have several number of cysts, which are fluid-filled sacs, or sac-like structures that are filled with fluid. And these cysts are being formed inside the ovaries. So this is the main issue that we are going to be experiencing whenever we are having PCOS. However, these, or whenever this happens, whenever these cysts are there, it's going to end up, or this will lead to an abnormal production of androgens, which are the male sexual hormones. And this is where the some of the symptoms that will be discussed later on are going to be related to this fact. For example, hirsutism. So whenever you start, or whenever the female starts seeing more hair being developed on her body, so this is a secondary male characteristics. Why are they ending up having these symptoms, for example? Because again and again, whenever these cysts starts forming inside the ovaries in numerous amounts, they will also lead to the production of abnormal amounts of androgens, because all females have some androgens, but they have them in few numbers. Whenever these numbers increase, this is where we start seeing some male secondary characteristics. And this is something that happens for anyone that experiences PCOS. Now, how does this entire thing happen, or why do we end up with PCOS? The thing is the following. As you know, every month or periodically, women, they secrete their what we refer to as the ovulatory hormones, or the hormones that leads to ovulation, which happens once every month, definitely if the female is not pregnant. Now, sometimes these hormones are not produced as needed. So follicle stimulating hormone, or FSH, luteinizing hormone, or LH, estrogen, progesterone, they are not produced as needed. For this reason, the ovulation do not happen, or the ovulation is delayed. When the ovulation gets delayed, this is when the ovaries might start developing these cysts. Whenever these cysts are there, they are the ones responsible for producing the androgens, or the male sexual hormones, in abnormal amounts, or in higher amounts. Now, the exact cause of PCOS, so the reason why the ovulation is delayed, the cysts are formed, and technically the production, or we end up having an abnormal production of androgen, the exact cause is still unclear. However, we have several risk factors, or we have several issues that are linked to PCOS. One of them is insulin resistance. Females with PCOS, they have insulin, or many of them, they have insulin resistance. What do you mean by insulin resistance? It means that the female body will be producing a lot of insulin hormones. However, these insulin hormones are not able to do their job efficiently. So the sensitivity, or the efficiency of insulin is low because of this insulin resistance. There is something preventing this insulin from doing its job. Now, as a result, as we just said, and because we need this insulin, or we need to remove the sugar from the blood, if the insulin are not very effective the body will end up producing a lot of insulin. This increase in insulin production will lead to an increase in androgen production. So now we have two issues or two reasons why androgens are being, or the production of androgen is elevated or increased. One, due to the formation of cysts inside the ovaries, and two, because of the fact that the female body will end up producing a lot of insulin because the insulin is not really efficient due to the insulin resistance. And this increase in number of insulin production will lead to an increase in the number of androgens production. Second thing, which is related to all these, is the hormonal imbalances. Remember, as we just mentioned in the previous slide, whenever the ovulatory hormones or the hormones responsible for the ovulation, so progesterone, estrogen, FSH, and LH, are not produced as needed, what's going to happen? We're going to end up producing those cysts inside the ovaries, leading to production of androgen. So again, hormonal imbalances are one of the reasons why we might end up with PCOS. Physical inactivity, as we're going to see later on when we discuss in the last few slides the benefits of exercise. Exercise will help in having a good balance of hormones, and exercise will help in having the period at its time. It's gonna help us, or it's gonna help females not to end up having delayed periods. So physical inactivity could be one of the reasons why we end up with PCOS. Obesity, definitely, whenever we are obese. So again and again, we're going to be discussing this in more details. It's going to be related also to hormonal imbalances. It's going to be related to the inflammatory status that PCOS females will be experiencing. And finally, as all medical problems, we always have a genetical factor or a family history factor that makes someone more prone to end up with PCOS. Now, let's discuss the symptoms of this medical problem. Number one, as we mentioned previously, irregular periods. So you're going to be having like missed periods or very light periods. We usually refer to the term, or we use the term delayed periods. This is when the period is taking longer than 35 days. It doesn't have to be 36, so it's anywhere beyond 35 days, or it might happen in time, but it's going to be a very light period. You're going to be experiencing, or females with PCOS will experience enlarged ovaries with definitely many cysts formed inside or at the level of the ovaries. Due to the high production of androgens, we're going to end up having the secondary male characteristics like hirsutism, so excess body hair mainly at the level of the chest, abdomen, and back. We're going to end up having some acne or greasy or oily skin, male pattern baldness or thinning of the hair, weight gain specifically at the level of the abdominal area. And usually females with PCOS, unfortunately, they will end up having some difficulty losing weight. Small pieces of excess skin might be present, especially at the level of the neck or armpits. This is what we refer to as dark and thick skin patches. We're going to be experiencing some people will experience mood swings, anxiety, depression, and part of it is related to these symptoms that they are experiencing that we just mentioned. And due to the fact that we're going to be having, or we might end up having insulin resistance, so there is a chance that we end up with high blood sugar levels that might end up becoming diabetes, or that might end up or that might lead to having diabetes in the future, which is one of the possible complications for PCOS. So you have definitely type 2 diabetes, as we just mentioned, as a complication of PCOS. You have higher chances of developing cancer at the level of the uterus. We're going to be having a high chance to, or there is a chance to end up with cardiovascular problems. Remember, obesity and insulin resistance, all of these, physical inactivity, all of these factors, when combined altogether, hormonal imbalances, they will definitely affect our heart and definitely the blood vessels or the cardiovascular system. hypertension, high levels of cholesterol, etc. And some people will experience fertility problems, mainly whenever the ovulation is missed or delayed. So technically they won't be able to, and as we know, in order to get pregnant, the sperm needs to be, or technically where the fertilization needs to happen. So if the female is not experiencing good, or doesn't have a good or a balance, or hormonal balance, doesn't have specific dates for ovulation, and the cycle is not working as it should, this will definitely affect the ability of the female with PCOS to bear child or to become pregnant. So these are the symptoms and the possible complications of PCOS. Now, how do medical doctors end up diagnosing someone with this medical problem? We have three main ways that the medical doctors use. One, the pelvic examination. So it's a physical examination in which they will be able to see the cysts at the level of the ovaries or inside the ovaries, alongside with other symptoms, the ones that we just mentioned. You have the imaging or the ultrasound imaging, and again, they will be detecting these cysts at the level of the ovaries. And finally, you have some blood tests that we can use or in these blood tests, we're going to be targeting the amounts of blood sugar, or the levels of blood sugar, alongside with the levels of androgens. And mainly, they're going to be checking the levels of androgen for one simple reason, which is PCOS means that you're going to be having a lot of cysts in the ovaries. It's going to mean that you're going to be producing a lot of androgens. However, not every single female with PCOS is going to experience insulin resistance. So not everyone will experience high levels of blood glucose, but definitely they're going to be higher levels of androgen. That's why they mainly target the levels of androgen whenever they go for the blood test, but definitely they will check the blood sugar levels as well to see if this is also happening or is also present, to know how to deal with it medically. Now, what are the suggested treatments for PCOS? Number one, which is very, very, very important, lifestyle changes. And here we're talking mainly about physical activity and weight loss. Remember, one of the very important risk factors for PCOS is obesity and physical inactivity. So this is where we need to start our management of PCOS. Weight loss and physical activity. Definitely physical activity will help us in weight loss, but we have to take some things into consideration when it comes to our diet in order to help us, or in order to help someone to be able to lose weight, because definitely physical activity will increase the caloric expenditure, or technically the energy or the calories out. However, we're going to be also taking into consideration our diet, or we're going to be discussing some strategies that we need to be applying when it comes to our diet. On one hand, to be eating in a healthy way, and on the other hand, to be eating foods that are nutrient dense but do not have a lot of calories. So by performing physical activity, we're increasing the calories out, and by taking care of our diet, we are decreasing the calories in, to help someone lose weight, because again and again, obesity is one of the main reasons why someone might end up with PCOS. Number two, we have medications. Now, the medications will differ whether the client is willing or wants to become pregnant or not. So if, let's say, the client wants to become pregnant, we use some medications that stimulates ovulation. However, as any medication, they will be having some side effects. One of these side effects might be multiple birth. Another side effect might be bloating at the level of the abdomen, or abdominal bloating, and finally, some pelvic pain. But again and again, if the female is not willing to become pregnant, or to conceive, or to bear a child, we can be using, for example, other medications like birth control pills. They help us controlling the menstrual cycle and decrease the levels of androgen. They help us in reducing the acne or the greasy skin. However, if we take the birth control pills, definitely the female will not be able to become pregnant. We have sometimes we use the diabetes medications. Usually they use a lot metformin, again and again, to try to help someone, especially if they are experiencing insulin resistance, to lower down the insulin resistance and have a better control of their blood sugar levels, because these will have, or these might end up leading to other complications that we need to stay away from, definitely. And finally, we use medications, or the medical doctors will be using medications to treat any possible symptom of PCOS, like acne, like breezy skin, like reducing the hair growth. So you're going to be having or sometimes you're going to be seeing people with PCOS taking some medications that are different than the diabetic medications, the ones that stimulates ovulation, or the birth control pills, just to have a better management of a possible symptom that someone with PCOS is experiencing. Now, after discussing the medical part, if you want, of PCOS. So what is PCOS, the risks, the causes, the symptoms, the possible complications, the diagnosis, and the treatment. Now we go to the lifestyle modifications. We're going to be focusing now on the lifestyle modifications, because again and again, remember, as personal fitness coaches, we are not allowed to prescribe medication. We're not allowed to diagnose. We need to have a good idea of them, because we need to be in contact with the medical doctor that are helping these clients with PCOS. However, our main role will be more directed towards exercise mainly, and we need to have a good knowledge of nutrition, or of the or to have a general idea about the nutritional strategies in order to have a better management of PCOS. So let's start discussing those nutritional strategies. Based on the studies that we have so far, we don't have something that we call a diet for PCOS. So we don't have a specific diet for PCOS. However, studies have shown that diet itself plays a very important role on the clinical picture and on the laboratory findings of PCOS. So yes, we do not have a specific diet for PCOS. However, this diet, or if we have a good control of our diet, if we apply the strategies that we will be discussing right now based on the studies, definitely, that we're done, we're going to be helping people with PCOS to have a better or to have a better management of it by having a better clinical picture. So when it comes to symptoms, and definitely when it comes to laboratory findings or the tests, we're going to be seeing some improvements in the tests, and definitely improvement in the entire, or in the general case of PCOS. So based on the studies, someone with PCOS needs to take the following into consideration, or need to make sure that they are eating the following in their diets. 1, fruits and vegetables, not just any fruits and vegetables. The studies have focused on the fact that go for fruits and vegetables that have low glycemic index and that are non-starchy, or in other words, they do not have a lot of starch or a lot of carbs. So here we have a few examples to be taken into consideration. So we're going to just skim through them real quick. Artichokes, asparagus, Brussels sprouts, broccoli, cabbage, cauliflower, celery, cucumber, eggplant, mushrooms, onions, peppers, spinach, tomatoes, turnips, zucchini, melons, berries like strawberries, raspberries, blackberries, and blueberries, citrus fruits like orange, like lemons, like tangerine, grapefruits. We have peaches, plums, apricots, cherries, and pears. So all of these are very good to be, or to be included in the diet of someone with PCOS when it comes to fruits and vegetables. In addition to those, we need to be consuming low-fat dairy products. Remember, we need to help these person get the nutrition out of it, but at the same time to lose weight, or to manage their body weight accordingly. Go for fish, because it's rich in omega-3, one of the things that decreases inflammation, which is something very important for someone with PCOS. Lean red meat in small quantities. So go for the lean one that doesn't have a lot of fat, that doesn't have a lot of saturated fat. Go more for towards chicken, so the white meat if you want. When it comes to fatty acids or fats, go for olive oil, or olives by itself, vegetable oils, fish oils. Go for almonds, pumpkin seeds, sunflower seeds, sesame seeds. So try to use these and stay away from like frying things, or if you want to go for frying someone, like definitely it's better to have a very low amount of this of these oils instead of eating like a lot of French fries, let's say. And you can use them as a substitute. Like, for example, olive oil can be used instead of butter, let's say, if we're trying to fry an egg, for example. So these are the good fatty acids, or the fatty acids that are better than the other alternatives. So this is something to take into consideration. Whole grains are very important. Like, go for anything like brown pasta, brown rice. Whole grain products are important to be included in the diet. Fluids, staying hydrated is extremely important for the blood circulation. Limit the amount of sodium, because again and again, one of the possible complications of PCOS is cardiovascular problems, and here you have hypertension, and as we know, sodium increases blood pressure. Try to avoid alcohol, try to avoid sugary beverages, and definitely try to avoid snacks that have artificial sweeteners, because remember, we have some insulin, or many people with PCOS will end up having insulin resistance, and we're going to be, or we need to avoid any type of diets that are rich in sugar, because these will make things even worse, because they will be increasing the blood sugar levels in those clients with PCOS. Now, the main goals when it comes to nutrition are the following. Number one, as we just mentioned, avoid any type of food that is very rich in sugar, because PCOS clients have insulin resistance. Number two, avoid the high caloric diets, because this will definitely help in weight loss. So it's not just going to be improving it's not going to just improve the hormonal imbalances, but also is going to be improving the insulin resistance. And definitely go for vegetables, fruits, and go for the whole grains, go for the fish, because all of these have anti-inflammatory properties that help a lot when it comes to diet, or when it comes to nutritional strategies. Now, after discussing those nutritional strategies, we're left with the benefits of exercise. And this is something very important, where we're going to be starting by discussing the benefits of exercise in general. And then we're going to go to discuss what the studies are saying when it comes to specific parameters or specific causes of PCOS, or how to have a better management of these causes or risk factors of PCOS. So the first benefit of exercise is to improve the insulin sensitivity. Whenever the insulin sensitivity is improved, the women with, as we know, women with PCOS, they suffer, unfortunately, from a higher risk of insulin resistance. So by doing exercises, we are trying to limit as much as we can the possible complications, which are elevated blood sugar levels that will lead to other metabolic abnormalities. Definitely, as you know, diabetes can lead to cardiovascular problems, definitely in the future. So we're trying to manage this by exercise, because exercise will help improve the insulin sensitivity, which is something pretty much needed for PCOS clients, because they might be experiencing insulin resistance. Number two, reducing inflammation. As we just mentioned, diet will help us reducing inflammation by using fruits, vegetables, fish, whole grain. All of these can help in reducing the inflammation, but also exercise will do the same. Unfortunately, PCOS is associated with chronic low-grade inflammation, which can lead to several health problems. So again and again, we're trying to manage this risk factor due to or using exercise. As we all know, exercise will help us lose more calories or burn more calories. So technically, they will promote weight loss or help us to lose weight. And many women with PCOS, they struggle, as we said in the symptoms, they have difficulty in losing weight or in managing this weight. And as we know, excess weight will make the PCOS symptoms even worse. Next, we have the reproductive function. So definitely, as we just mentioned, PCOS clients, they have irregular menstrual cycles. They might be experiencing infertility as one of the complications. Exercise, based on studies, have shown to improve the regularity of the periods or of the menstrual cycles. It increases ovulation in women with PCOS, which can definitely improve fertility and improve the clinical aspect of women with PCOS, or help them regain this stability when it comes, or this regularity when it comes to their menstrual cycle. And finally, something very important that unfortunately many females with PCOS might end up having, which is stress and anxiety. As we know, exercise, or by exercise, we stimulate the body to produce the good feeling hormones or the endorphins, which are going to help a lot in controlling our mood, in controlling or in reducing stress and anxiety. So these are the benefits of exercise. If we're going to be talking about these exercise benefits as a whole or in general, now we're going to go for more details and discussing the benefits of exercise on specific parameters. And definitely all of these information are coming from studies, systematic reviews that were done to tackle this factor. Let's start by tackling the BMI. As we know, the body mass index, or BMI, is used only for people that are obese or overweight, not for people that are athletic or that have a high lean mass. And remember, clients with PCOS, they will be experiencing, or they will be having, or they will be overweight or obese. This is why we're talking here about BMI. According to a meta-analysis of 17 studies, included 759 women with PCOS, showed that the largest reductions in BMI, or body mass index, were reported whenever women were performing high-intensity physical activity, high-intensity cardiovascular training. So if we are targeting, or if your main goal is to lower the BMI or to help clients in having a better body mass index, high-intensity physical activity is extremely important. And here they have seen, they didn't just talk about cardiovascular training or just resistance training. Combining both is the best solution, but the most important parameter is vigorous intensity. So high-intensity physical activity showed better results compared to lower intensity physical activity. And definitely when they added some diet intervention, this resulted in better, or in a further decrease in the BMI of women with PCOS, which is something extremely important because it's going to help us lose weight or control our weight. Next, we're going to be talking about the waist circumference. Why waist circumference? Remember, waist circumference is usually where the visceral fat is located. Visceral fat is the fat that fills the space in between the internal organs, making the function or the efficiency of these or decreasing the function and efficiency of these internal organs, and definitely making us more prone to end up with several complications like cardiovascular problems, for example. So 13 studies that included 463 women showed that vigorous intensity physical activity again and again showed the greatest reduction in waist circumference when compared to steady state cardio, and specifically low intensity steady state cardio. So interval training, vigorous intensity, high intensity cardiovascular training is better than low intensity steady state cardio when it comes to improving the waist circumference. And here they also discussed, or they also tested the dose dependent relationship, and they have seen that results were better when this amount of physical activity, or when these women with PCOS kept on performing high intensity physical activity for more time, or for longer duration. So they tested it at 20 hours, 30 hours, and 50 hours, and they have seen the best results for women that were exercising for 50 hours. So technically speaking, the more you exercise, the better the results when it comes to waist circumference. And always remember here, ladies and gentlemen, yes, vigorous intensity or high intensity is showing better results when it comes to BMI, showing better results when it comes to waist circumference, but not all clients, or if you have a client with PCOS that is physically inactive, she will not be able to directly start by performing high intensity physical activity. So it's totally fine. You start with steady state, low intensity cardiovascular training, and from there you progress until you reach until you reach a stage where your client is able to start performing interval training, is able to start performing high intensity physical activity, and this is when she will be seeing better results when it comes to BMI and waist circumference. Now, next is a very important parameter that is seen with all clients with PCOS, which is high levels of androgen. And this is detected medically by what we call free androgen index, FAI. According to 16 studies included in a meta-analysis with a total number of 667 women with PCOS, it showed that the greatest improvement when it comes to free androgen index occurred whenever women with PCOS were performing resistance training. This does not mean that cardiovascular training is not going to help in reducing the amount of androgens, but the results of both low and or moderate and high intensity cardiovascular training showed, or the results when it comes to free androgen index were a bit like there were light differences, or the what we call like small changes, or they caused a small decrease in the free androgen index. However, we have seen much better results or higher decrease in the levels of free androgen when females were performing resistance training. So this is something very important, and this is why resistance training is a must to be included alongside with cardiovascular training, not just because it helps in controlling the BMI, the waist circumference, and the weight loss, but because it showed the highest or the greatest improvement in the free androgen index, which is something that PCOS women will be struggling from, or will be experiencing, unfortunately, due to the fact that again and again, they are having these hormonal imbalances. They are having those cysts in the ovaries that are leading to the production of these androgens. So resistance training is showing the greatest improvement. Definitely, when this resistance training is combined with a good diet, the effect is even larger. And definitely here again and again, it's a dose dependent relationship. So again, they tested, or they asked females to perform resistance training for 20 hours, for 30 hours, and for 50 hours. And definitely females that exercise for longer duration, so the 50 hours group has seen the best results or better results compared to the group that performed resistance training for 30 hours only, or 20 hours only, when it comes to the free androgen index. Next, insulin resistance. 11 studies, including 307 women with PCOS, were included in this meta-analysis to check the effect of exercise on insulin resistance. And definitely, as we mentioned in the previous benefits, exercise will help or will increase the sensitivity of insulin. So definitely this will be reducing the insulin resistance, but specifically high intensity cardiovascular training, when combined with resistance training, they have both resulted in moderate reductions in, or moderate decreases or reductions in insulin resistance, compared to the control group that was not performing any physical activity, that have PCOS but was not performing physical activity at all. So when it comes to cardio, again and again, higher intensity when possible will be leading to better results, and combining resistance training or adding resistance training to this factor will also help in decreasing the insulin resistance and increasing the insulin sensitivity. Because remember, when we perform physical activity, including resistance training, definitely, so cardio and resistance training, muscles will be using a lot of energy, they will be using a lot of carbs, so they will demand more carbs. This will help in delivering those glucose from the blood towards these muscles, and by this, or by doing so, we're going to be helped in decreasing the resistance of insulin, or improving the activity or the efficiency of the insulin job to take the sugar away from the blood and put it inside our cells, and specifically here we're talking about the muscles since we are performing physical activity. Now, in general, and for greater improvements, our aim for clients with PCOS is to reach and sustain a minimum of 20 hours of vigorous or high-intensity physical activity for a duration that is more than 10 to 12 weeks. So technically speaking, we're talking about 120 minutes of high-intensity physical activity per week for a duration of 10 to 12 weeks. Now, definitely, the more the merrier, the more the better. So if we are able to keep on performing high intensity physical activity for longer than 12 weeks, that's even better. That's amazing. However, our aim to see those results, to see those improvements when it comes to BMI, waist circumference, insulin resistance, and free androgen index, so to see the best possible management when it comes to lifestyle modifications, or specifically when it comes to exercise, is whenever we are performing high intensity physical activity for 20 hours per week for a duration of 10 to 12 weeks. So technically speaking, I'm sorry, for 20 hours over 10 to 12 weeks. So that's technically 120 minutes per week. So if we keep on performing 120 minutes per week, we will be able to have the best possible management of PCOS coming from exercise or using exercise. Now, we're talking here mainly about cardiovascular training only. So those 120 minutes per week are coming from cardiovascular training, high intensity cardiovascular training. Again and again, minimum of 20 hours. Our aim is to go for a minimum of 20 hours over a duration of 10 to 12 weeks, which means 120 minutes of high intensity cardio per week. However, and due to the fact that resistance training will be helping or will help us to have, when combined with cardiovascular training, is going to help in weight loss, BMI, waist circumference control, insulin resistance, decreasing insulin resistance. But most importantly, according to studies, definitely, it was the one that decreased the most the free androgen level. 2 days per week of resistance training must be added also in order for people with, or females with PCOS, to have the best possible control or the best possible management coming from physical activity and coming from these lifestyle modifications. So after discussing the medical aspects of PCOS, the nutritional strategies, and the benefits of exercise when it comes to the general benefits, and definitely the specific parameters like BMI, waist circumference, insulin resistance, and free androgen level, always remember the following. When helping a client have a better management of PCOS, it is very, very, very important that exercise is combined with other lifestyle modifications. So we have healthy diet, and we need to be compliant with the medications that the medical doctor has prescribed. So exercise is not here to replace medication. Exercise is here, or the lifestyle modifications, at first, they are here to help have a better management, or to have to form an alliance with the medications that the medical doctor is prescribing in order to have the best possible management of PCOS. Now, later on, if the medical doctor sees that the condition is improving really well, and due to the fact that the client is performing a lot of physical activity and is having a very good diet, and this is helping them a lot, they might start decreasing the dosage of the medications that are prescribed. However, this is the job of the medical doctor, not our job as fitness coaches. For this reason, always remember, and before designing a training program for a client with PCOS or polycystic ovary syndrome, it is extremely important to consult with their medical doctor, have a better understanding of the situation, and plan accordingly. Make sure that you are always cooperating with them. Make sure that you're always working within your scope of practice. And in this way, you will be able to design or to plan an exercise or a training program that is safe and efficient for your client, because always safety is a priority, and definitely right after safety we have the efficiency. So it's very, very, very important to make sure that your client has a medical clearance. It's very, very, very important to cooperate with the medical doctor when planning a training program, that or whenever you do so, you will be able to design this training program that suits that specific client the most. Now, finally, I'm just going to be sharing with you the references. So in this slide, you can see the references from where we took this information in order, or the information that we provided you with, in order for you to have a better understanding of the of PCOS in general, and how to manage PCOS in the best possible way. And definitely we focus the most on our scope of practice as fitness coaches, which is physical activity or exercise. Hope you enjoyed this session, and looking forward to see you again and again in upcoming or in future sessions.